To function at peak level, the body requires enough calories or fuel. Now, between regular training and competition, athletes ask an extraordinary amount of their bodies. So, consuming enough fuel on a regular basis is critical, not just for performance, but also for overall health and recovery. Plus, young athletes require extra fuel for proper growth and development. When athletes do not consume enough fuel to meet energy needs of daily living, plus the demands of training, they can become at risk for relative energy deficiency in sport, or REDS. REDS is connected with adverse effects on several parts of the body, and it affects both male and female athletes. Consequences of REDS include, but are not limited to, decreased daily calorie burn, or decreased metabolism, menstrual dysfunction in females, or reduced testosterone levels in males, impaired bone health, stomach and digestion problems, impairment of the body's cardiovascular, hematological and immune systems, slowed growth and development, and negative psychological impacts, which can all impact performance. Here are common signs and symptoms of REDS in athletes. New upset stomach or difficulty eating that is not attributed to an illness. New or increased frequency of stress reactions and/or stress fractures. Frequent and sometimes prolonged illnesses or infections. Low resting heart rate, less than or equal to 45 beats per minute first thing in the morning before sitting up. Depression, anxiety, irritability, and/or difficulty concentrating. Slowed growth rates or falling off your growth curve at the doctor's office. Unexplained fatigue, complaints of heavy legs, and/or feelings of being cold. Low iron or vitamin D levels, unexplained decrease in performance or strength. Training that feels more difficult than it should. For females, an absent or irregular menstrual cycle or a delay in having your first period. There are several factors that can put an athlete at an increased risk of low energy intake and the health consequences of REDS. Short-term and abrupt changes in body mass and composition, making weight, and participating in endurance sports or sports where athletes are judged based on body appearance. Attempting to lose weight when training load is high. Long periods of low food intake due to inadequate food availability, including food insecurity, lack of financial resources, busy travel and training schedule, lack of adequate cooking space and equipment, or lack of priority placed on food. Low food intake due to medical conditions or cultural and religious eating practices, such as Ramadan, Lent, or Yom Kippur. Abrupt changes in training volume or intensity without changing the amount of fuel consumed. Presence of intentional restriction or limiting foods the athlete allows self to eat. Diets that are very high in fiber, such as fruits and vegetables, and very low in high-calorie foods, such as fats, oils, cheese, etc. Hey coaches, exposure to a coaching staff that places an overemphasis on weight and body fat, as opposed to performance in sport, can also put an athlete at risk for REDS. Realize that athletic performance is determined and improved by over 40 physical and psychological factors. Weight is just one of these factors. If you're experiencing one or more of the symptoms mentioned, talk with your parents and then see your primary care physician, who can connect you with a registered dietitian who specializes in working with athletes. You can experience only some of these symptoms and not have REDS, but be at risk for REDS, and would still benefit from working with your doctor or RD to improve performance. With education and medical assistance, the health and performance consequences of REDS can usually be reversed, leading to better long-term health outcomes and better performance for the athlete.